Yeah, this class is being recorded so that those that are not able to join us today will be able to join us. And so now, Africa, can you unmute yourself? And the floor is yours.
Good evening, everyone.
Good evening.
I hope we all can hear me very well.
Yes, yes, I can hear you from my side. Yeah.
Okay, that means
sure,
at least
I can assure you that everybody is hearing you as well.
Okay.
I can hear you from my side loud and clear. By the way, before you start, thank you very much for honoring this invitation. I know how busy and how stressful NHS job our job can be, but you took out your time to be part of us today to share the little information you have. I sincerely appreciate it, and I'm sure everybody that is joining us today, appreciate your time as well. Thank you so much. So you can start the class now.
Okay, thank you. And I want first of all appreciate Abiodun for the initiative. It will still be on record that the idea that the initiative that bettered this idea is yours, and it's actually out of the will and the zeal to help Nigerian nurses and to be useful to the society. I want to commend that, and I'm sure very soon we are working on a bigger project, and we are going to definitely make it there. So good evening, everyone. Like Abiola rightly said, my name is Olaniyan Abiola, popularly called North Africa in the nursing community. I'm a UKRN trained Nigerian nurse. And this evening, we'll be talking about mistakes we should avoid when applying for NHS or jobs in the UK generally. It is not enough to just wake up and apply on track jobs, Indeed, NHS job and stuff. It is also important to apply right, apply to the right job, and fill in the right information. I can see like 38 people online, which is a very good one. I'm sure a lot of people will still join up in the course of our discussion. So I've actually prepared something of a presentation to guide our discussion tonight, and also to help us navigate through every part of the topic of discussion, so that I won't leave anyone without touching it. So I'll be sharing my screen with everyone.
I want to be sure you can share your screen. I think I need to give you the permission to do that.
Yes, definitely.
Okay, so I'm just going to look for you, and then I'm trying to see if I can allow you to share screen. Okay, so I'll make you an host. And I'm sure if I make you the host, you'll be able to share the screen. But I don't know if the recording will be on my laptop or on your laptop. But whichever way, once I make you the host, you can just do the recording on your laptop if I can't do that from here. Is that right?
Okay, we'll definitely confirm if you can do it from your end after making me the host. And if you cannot, I'll do it from here.
Yeah, okay. So you're the host now.
Oh, can we have a co-host? I think it will be.
I don't think so. I don't think so.
Oh.
You are the host now. I'm sure you should be able to share your screen now. The recording is going on my laptop here.
Okay.
Yeah. Can you share your screen now? Are you seeing an option to share your screen?
Yes.
Okay. Yeah, we can see your screen now. Or is your WhatsApp chat that we can see? We'll see your WhatsApp chat.
I've actually gone ahead of that. What can you see now?
I can see your WhatsApp chat only. More like your browser.
Oh.
So it's currently on your browser now. We can see your chat only now. Okay, we can see your face. So once you select share screen, it gives you
I'm
the
sure you
option.
are seeing the right.
Oh, fantastic, fantastic. We can see the screen now. Mistakes to avoid when applying for a nursing job in the UK. Yes, yes, yes. We can see it clearly now. Thank you.
Okay. So we'll have to be admitting everybody as well.
Yeah, I think so. I think so. I think so.
Okay. I'll try as much as possible to multitask.
Yeah, I know, right?
Okay. Good evening, everyone. Like I said, my name is Abiola Olaniyan. I'm popularly called Nurse Africa in the nursing community. I'm a Nigerian trained nurse, presently working with Portsmouth University Trust in the United Kingdom. So this evening, we'll be talking about the mistakes to avoid when applying for a job or a nursing job in the UK. Oh, I am looking for the possibility of making Abiodun a co-host because that would be the best.
Yes, yes, if you can, please.
I think I should. Okay. Oh, I can't see the option.
No, the option is not there. Yeah.
So I'll try my best.
Yeah.
Okay. Now, this discussion, what is our goal for discussion today? The goals of discussion today is number one, to identify the common mistakes that we make, provide the solutions to the identified mistakes, and also making a standard application. We are going to talk extensively on how to make a standard application. And we're going to talk about briefly about preparing for an interview. I want to commend Principal Agedo for a job well done on Wednesday. When I couldn't join the I couldn't join the Zoom class discussion, but I took my time to watch the video. It's awesome. He did a very great and nice job, and kudos to him, and especially to the organizers as well. So after that, let's go straight to the point so that we'll have enough time for question and answer, because I'm sure a lot of us are actually having a lot of questions to ask. Now, I've noticed from observation that so many of us apply for the wrong nursing band. For every nurse applying from Nigeria, let me not say every, let's say majority of the nurses applying from Nigeria, you are expected to apply to the band 5 or band 4, preferably band 5 vacancies. Now, when you're applying to band 5 vacancies, you should be mindful as well of the steps in band 5 if it is stipulated in the job application. There are jobs, I've seen jobs that said you should apply if you are band 5A. There are steps in band 5. We have the band 5C, which is the entry point for nurses. Then you grow to band B or band 5B and later to band 5A. So when applying for a job, it is important that you apply for the right job. This is not to say that there are no nurse that should apply for band 6. Midwives, I think, have the upper hand to apply for band 6 from information as well. Nurses with good managerial experience can actually apply for band above 5. I've seen a Nigerian nurse who got a job directly in the managerial position in the UK as a band 6. I've also seen a band 7. There are rare cases, but they also happen. So we won't say 100% you should apply for band 5 jobs. Also, we'll talk about applying for jobs not open to international nurses. While applying for jobs, you definitely see in the job description those that want you to already be in the UK before applying for the job, and those that said that will stipulate that international nurses or nurses outside the UK can also apply for the job. If you keep applying for jobs that are not open to international nurses, you will not even see the unfortunately message. You won't be responded to. In some cases, you will see that nobody is even, the application will not go through. So this is another mistake that Nigerian nurses make when applying for job. Now, providing the wrong detail on application, I will always say this: when you want to apply for a job, it is a job itself. The application is a job itself. So it is important that you provide right information when applying for these jobs. Providing right information does not mean you provide the same information for every job. No. Yes, the right information is that my name is Abiola, and my name will always remain Abiola for every other jobs I'm applying to. But there are details that you need to be flexible about, which we'll definitely talk about as the discussion progresses when making your UK application. Now, we need to be very mindful here. There are different jobs in the UK that Nigerian nurses can apply to. It is not only NHS that employs, although NHS is the highest employer of Nigerian nursing labor in the UK, but it is not, those employment are not restricted, are not exclusive of the NHS. We have people that apply to community settings. We have people that have applied that have gotten job with a care home as well. It is important for you to know how to apply for each of these roles. You can't use an NHS application to apply for a job in the nursing home, or use the nursing home application to apply for a job in the community settings. Let me try and check. I can see a lot of people on the waiting list. Okay. Okay, now, moving away from there, say using CV that does not conform with job description. I'm going to be explicit when I will be dishing out the solutions to each of these problems. You don't, for any reason, use one CV more than 2 or 3 times. Now, the CV, I'm going to set an example with myself when it comes to CV. Yes, on Wednesday, we said you should have a good CV. You should have a CV by a professional. That is what I advised. I did that myself as well. But you should have a flexible CV as well. I'm going to discuss a lot on the issue of CV, because your CV determines the kind of job you get, the kind of offer you get. And also remember, the employer is not seeing you first. What the employer sees first is your CV. So your CV is a representation of yourself in front of the employer. How well you present it to the employer determines if you will be chosen among the multitude that are applying for the same role you are applying to. Are we still together?
Yes, we're with you, clearly. We're with you, Chief.
Okay. So now, a lot of us do copy and paste. It is, I don't want to use generic with students, nurses. I don't just want to use those words. But the truth is that we do more of copying and paste, even in our report writing. I'm sorry to diverge a bit. We just see patients or doctor informed this. That's what we do. But this will not help us when you are applying for a job in the UK. You just copy, or possibly because Biola have gotten a job in the UK, I sent you my supporting paragraph, and you just copy my supporting paragraph, paste it on your own, just change your name and 1 or 2 things, and you feel you will get the job just like that. No, it is not done like that. Too much copying and pasting is one of the major errors we do when applying for a job, not only in the UK, but everywhere we're applying for a job. Now, every job we always want to know about the current duties you do, what you do presently. Every employer want to know that. Now, my CV should not just read I'm an emergency nurse. No, yes, you can have thousands of emergency nurses applying for the same job. What am I doing presently that can stand me out among other people that are applying for the same job? So we should pay more attention to your job, the current job description that you are going to write. Remember, when you are writing your CV, you write from the newest job you are doing, from the latest job you are doing to the ones you have done before. So it is important you pay prompt attention. We are going to also be explicit when we are discussing how to write a good job description, especially the current job description. Now, I have seen a lot of people sending application, especially at the supporting paragraph level, with words that are common. The same word you will use is the same one I will use, the same one Abiodun will use, and like 80 of us applying for just 2 roles will use the same. How do you stand out among people? That is when your supporting paragraph or your CV or resume lack power words. There are what they call power words. They are words of action, a weight of achievement. These are power words. We are going to give examples of this as we progress in the course of the lecture. Now, a lot of us in our CV, in our supporting paragraph, I'm being particular about supporting paragraph now because principal have done a very good job about the CV. Now, in our supporting paragraph, which is supposed to be explanation of myself to the prospective employer, we tend to make a generic leadership and team playing section, like I can work confidently as part of a team with minimal supervision. That is what we say most of the time. 90% of us say that, but that does not actually stand you out. In the course of the discussion, we'll still look at what are these things that can spice up your supporting paragraph or help in detailing in a detailed work job application in the UK, not only in the UK, in every job you're applying to. Now, choosing the wrong referee. I've seen a lot of people choose referees, choose your pastor. Yeah, it's fantastic, nice idea. Your pastor might know you very well, but you should be deliberate in choosing your referee. There are things you need to do about your referee before even putting them as your referee. Number one, your referee should be aware that you are using him or her as a referee. And I always advise, as much as it is a delicate topic to touch, it is important you don't use your religious leaders as your referee. It is very safe not to use a politician as your referee. Rather, it is advised that you use people that you have passed through, as your people that you have worked under, either as an employee or as a student. So it is always safe to choose a 2 referee, one from your previous academic engagement and one from your current job engagement. Your referee should be somebody that will be able to write and say, while he was in school, is this, is this, is this, is that. While a referee should also be somebody that will say, in his current assignment as an emergency nurse in so place, I have done this, and he has performed beyond expectation. So the choice of referee matters a lot. And I've heard of scenarios where referees are contacted about applicants, and at the end of the day, the referee denied even knowing that they are used as referees. That alone has knocked you out of the job interview, not job offer. Again, there are jobs you will see. One of the reasons why your referee should know before using them as a referee and consent to using them as a referee. When you are filling your job, the on-track job or NHS job, you see a place where they write, can we contact this referee even before the interview? You click yes, but you have not told the referee that you are using them as referees. So it is important we look into that as well. Those are part of the mistakes we make while applying for jobs, not only in the UK, but across board. Now, we said we're going to look at the solutions to each of these identified problems. Now, before we go to the solution, can we just, since we have it's a paid Zoom class, we have enough time to use, based on the identified problems, Abiodun, will it be right to put in questions and answer at this point?
The sincere truth is that if we start taking questions, we might not finish the class. You understand? So I already mentioned it that people that have questions should just write them down. After the class, we are going to answer the question. So
Okay,
I will allow you to complete the class before we take the question, if that's
okay.
right.
Okay, fantastic. Thank you. So now, we'll talk now to the problem where we have identified. What are the solutions I said the first thing is that for international nurses, especially starters, job one should be for band 5 jobs alone, and only some cases will band 6 fit in. I think I've explained that as well. Make sure you look for band 5 jobs. Now, in looking for band 5 jobs, here is it. Be deliberate about what you are looking for. Don't just apply to every job you see. I am an emergency nurse. Because I'm looking for band 5 jobs, I should not apply to a band 5 job in the theater. My experience, my CV, my supporting paragraph might not fit in well like somebody that is working in the theater. It is very important that you are given a particular job and you are able to perform effectively in those jobs. So when you are looking, especially for nurses that are specialized back home in Nigeria, you should be deliberate in looking for jobs in your specialty. It is very important, and it will give you a better option when, as an emergency nurse, I'm applying to the emergency department as compared to a perioperative nurse applying to emergency department. Definitely the perioperative nurse should expect an unfortunate message, while the emergency nurse, having done everything right, should expect at least an interview or possibly a message that gives hope. Now, for the midwives, I advise that despite you can apply for a band 6 job, it is also good to be very careful of the details attached to those band 6 jobs. Now, the second solution we have identified is that reading the description is as important as applying for the job itself. A lot of us just get to the job offer, copy and paste. You can apply for 100 jobs in the space of 1 hour. Yes, very fantastic. But the truth is, every job has its special description. A job might tell you that, for example, let me use my trust as an example. We have an emergency department, and we have what we call MAU, Medical Assessment Unit. While applying for a job back home in Nigeria, I never knew the difference, because what I saw is acute medical unit. That is what I saw. And I felt like, as an emergency nurse, the word acute depicts emergency. So I kept applying to acute ward in the name of it's an emergency. No, which definitely is not. So reading the job description that details what is expected of you in your new role as a nurse will guide and help you in applying to the right job, instead of applying for multiple jobs without getting the positive response. So 2 jobs which have different clinical angle may require slightly different description of your current duty, so that you may focus on the aspects which are relevant to the post. Now, I will cite an example here to make it much more easier for us. Back home in Nigeria, I'm an emergency nurse. I work in an emergency department. Also, in my emergency department, we also cater for ambulance services. We do a lot of medical evacuation using the air and land ambulance. Now, if I'm applying for a job in the UK that stipulates ambulance, it is also an emergency job, but for somebody who never had an ambulance experience, it will be difficult getting those jobs, even with the right CV, with a very awesome CV, awesome supporting paragraph. You still will not get the job because of that detail of ambulance services. So little details can just change the scope of work you are expected to cover when you come over to the UK. And these are these are some of the reasons why we get those unfortunate messages. Now, making the right CV. I won't dwell much on this because that's why I highlighted it as Prince Agedo. He has done a fantastic job and kudos to him on that. Now, in the description of duties and responsibility, don't just state the obvious. When I was making this presentation, I felt like, oh, will it be nice I just highlight the points here, or I become a bit more detailed, because I know some of us might want to be noting it. Now, that's why I brought more detailed information here. I said, in description of duties and responsibility, don't just state the obvious. Yes, the obvious is what everybody will say. No one will give you credit for saying that you attend MDTs, you run clinics, and participate in teaching. Very fantastic. You have done well, but everybody can also do that. But rather, instead of doing all this, it is better to sell your clinical independence. Set out your clinical experience relating to the area you will cover in your new post, stating some of the most notable achievements. Here, going back to my example of using of ambulance services, if I'm to apply for a job in the ambulance services now, I will definitely state that I work on the ambulance, not that I work as an emergency nurse in the emergency department. I would rather say I work on the ambulance, and working on the ambulance have exposed me to so, and on such occasion, on several occasions, I've been able to provide or resuscitate fully a patient in cardiac arrest. Are we together? Hello?
We are with you.
Okay. So I'm trying to do double job. I'm trying to admit those that are on the waiting list.
Thank you.
Okay. Okay, now, say the reader must come out of reading your application thinking that this person is working at a consultant level already. Stating your MDT simply won't do that. Now, what you are trying to do is that you're trying to make give a lasting impression to the employer, to the recruiter. Now, just stating that you attend an MDT, you run a clinic, you do this, you do that, that is what every other person is also doing. And that will not give that lasting impression you are expected to give to an employer. Now, what are power words? Power words makes your supporting paragraph very fantastic. It helps you also in making that lasting impression we want to have with an employer. The power words are words that signal an intent and an active achievement. An example of such is, I participated in a number of audits. Definitely, yes, it's good. I participated in a number of audits while working in the emergency department. But that does not give you the feeling that you took charge or you actually did anything of interest. And neither does telling me that you attend MDT on a regular basis also gives any good impression about you. It only tells me that you are doing the normal, not going out of board to do another thing. Now, using words, sorry. Okay, using power word to give you something along the line of, I led and managed a team of junior nurses through 5 audits. Following 2 of those audits, I revised and implemented revised guideline on the so topic and so topic, consolidated the junior nurses rota, and organized a monthly departmental training session on so topic. Now, see the difference. I would have written this as I participated in 5 audits with other nurses. That's one. That is another way of writing this. Then I will also say I participated, I was involved in the implementation of the revised guidelines. That's another thing. That's another way of writing this. Or monthly, I participated or I trained other nurses on cardiac or basic life support. These are words that will not bring that lasting impression. But an employer reading your lines as such, I led and managed a team of junior nurses through 5 audits. Following 2 of those audits, I revised and implemented the revised guidelines on so topic and so topic. That is 2 out of those 3. You are not saying you did the 5, but you are claiming an authority for 2 out of 5. Then you consolidated the junior nurses roster. That shows that you are a leader in your capacity and organized a monthly departmental training session on basic life support. That also shows your teaching ability to be how to be into the department.
Please, can you mute them? Can we all mute ourselves?
And they will get back to him for the list.
Okay.
Yeah, so I'm going to so I'll come in with the list here for one, and get back to the
Please, you can hear your call.
And never the rate of your one again. After payment, the original result.
Actually, how can I mute this person?
The name of the person is Abiola Olaniyan. Yeah, just Abiola Olaniyan. Okay, yeah.
Okay. Hello?
Yeah, we can hear you.
Okay, now.
You can continue. Thank you.
So, we should always stay clear of phrases such as I was involved in. I mentioned that before. I participated in. I enjoy teaching junior nurses. I have passion for emergency. Instead, use words which explain your contribution, to whatever you have done. This is about, definitely, if you look at everything I've been discussing from the beginning, it is actually centered on supporting paragraph where you are providing information in your job application. Don't just think all the application you did on that employers don't read your supporting paragraph. It is too much, they won't read it. Definitely no. They read these applications. We have a team of HRs in every trust who are paid every month to sieve CVs and pick out the best from them. So you just sending anyhow supporting paragraph or CV will not get you the desired job. Now, active involvement in teaching trainees is very vague. Why setting up? Instead of telling I actively participate in the training, in the teaching of trainees. Wow, no. Instead, I set up mock vivas for nurses on clinical rotation within my spare time. That shows a more proactive contribution than I actively participate in teaching of trainees. These are 2 words, and I'm sure at this point in time, as nurses, having passed our high health, we should be deliberate, we should be mindful and be very good with the use of words, especially when it comes to paraphrasing. So I can send you my supporting paragraph that got me a nice job. I don't expect you to use exactly the same supporting paragraph. With your skills in paraphrasing, you should be able to turn the supporting paragraph around and make it a very nice one that will suit your own application. Now, carefully select your referees. I'm sure we've discussed much about how to select referee and gaining consent of referees before even using them as a referees. Now, let's look at the tip for supporting paragraphs. The first tip we're going to discuss is we said be flexible with supporting paragraph. What we mean by being flexible with supporting paragraph is that you shouldn't use the supporting paragraph you used to apply for a job in the emergency department to use this. You don't use the same supporting paragraph to apply for a job in the orthopedic or surgical department. Be flexible with it. Be able to change one or two things that give you that distinct uniqueness about you applying for that role. If you are applying for a job in the nursing home, it's entirely a different supporting paragraph. You need to be able to prove to the employer how much care, how much contact you already have with elderly people, as against me that is applying for a job in the emergency department, where I will always want to prove to the employer that I've handled several emergencies as an emergency nurse, and these are the achievements I've achieved. These are the things I've achieved managing those emergency cases. If possible, I will give examples. Then have a good structure for your supporting paragraph. Now, for everything you are doing, you don't just mingle well together. Like the way you write your IELTS paragraph, it is important that you also have a structure for your supporting paragraph. Now, a supporting paragraph should be one where you transmit from one stage to the other. You transmit from the introduction of self to what you do, what you have done, and what you will give. Okay, it's introduction of self to what you have done, that is the past, the present, and the future. Now, in the past, this is what I have done, which earned me where I am presently. And in the role as a nurse, that is the role I'm looking forward to. These are ways I'm going to add value to the organization or to the trust in my own role. Now, always add something unique to make you stand out. If you have an achievement, trust me, I will always say it anywhere. Each time I'm applying for any job, I'm looking for something from you. I'll be fast to tell you that in the field of emergency, I have received an award from Nursing and Midwifery Council as the best emergency nurse in so year. That alone gives me an edge, whether you like it or not. I'll also be fast to tell anybody, I'm sure Abiodun will be very fast to tell anybody that applying for an emergency nurse is a certified BLS, ACLS instructor, and I've won so award doing those things. So these are things that stand you out. Okay, all of us are an emergency nurse. Abiodun is an emergency nurse. I'm an emergency nurse. Abiodun is a BLS instructor. I'm a BLS instructor. Abiodun is a ACLS instructor. I'm an ACLS instructor. Now, two of us are applying for a particular job. That is the way you should look at it. So when preparing your supporting paragraph, if you have all these ideas in your head, it helps to bring out the best in writing your supporting paragraphs. When you see yourself as competing against people that are even better than you, it helps you, it pushes you to the limits to give the best representation of yourself in that. Now, never had irrelevant information that I attended one school, and when we were in clinical posting, I attended clinical posting in medical ward. All those things are irrelevant as far as supporting paragraph is concerned. Supporting paragraph should be something that you will write, and I'll picture, okay, this is this person. I think this person is serious about this job. This person is already looking at him or herself as having this job already. That is what supporting paragraphs will say. That is why they say call it supporting. You have entered your details, the school you went to, the jobs you have done, your referee, your, what do they call it, your everything information now. This is for you now to support those things. Probably you have even sent your CV, but this is now for you to support those things. Like, okay, this is my expertise. These are things I can do very well, and these are things I have done before, and trust me, when you give me this job, these are things I will do. These are what I will bring on board to your organization. Now, before we dance to the end of the class, I want to talk about people applying for job directly. Probably you have a contact. I give you the contact of my HR, probably after previous discussion with the HR, and the HR says, okay, send your CV to me. Instead of just sending your CV, remember, the supporting paragraph is also important, because the CV can be sent and 1,000 people can send the same CV you are sending to the employer. 5 or 10, the job of the post available is for 5 nurses. 20 of you are from Nigeria. 20 of you have gone through Princewill training or probably engaged Princewill to make a CV for you. Princewill have made fantastic CV for 20 of you. 20 of you submitted the same CV Princewill made to one employer. Now, what to stand you out in such case is the supporting paragraph you send to the employer, which is why we need to be deliberate about making a very good and comprehensive supporting paragraph. Remember, the supporting paragraph will tell you that you are allowed to use, I think, 1,500 words. Don't look at it as this is too much. No, maximize it. They have a reason for saying 1,500 words. If they cannot go through it, they won't talk.
Check the other one.
I'm not saying you should send 1,500. No, I'm saying that if you have written your
the two of them, they work now.
If you have sent your supporting paragraph in a captivating manner, that will entice you to read more. That will entice the employer or the HR to read your. Please, can we all mute ourselves?
Which one?
Okay, so the person that is talking now is Flosinasa. If you can just mute.
Which me?
Okay. So it's very important that when you are writing your CV, when you are writing your supporting paragraph, you should make it in such a way that I'm sure a lot of us must have read books, or maybe some of us must have read books written by the likes of Chinua Achebe, the likes of Wole Soyinka. If you have ever read those books, you will discover that the moment you take, especially if you are somebody that loves reading novels, the moment you read the first page, somehow you become attracted and you just want to know what is the next thing, what is the next stage. Like movies too, when you watch movies, you've seen a scene of movie and you feel like, okay, I can't wait to see the next movie. That's why they keep producing season 1, season 2, season 3. And we all wait for season 3 to come outside after watching season 2. We'll even be asking, when is season 2 coming outside? The moment season 3 comes outside, we want to go and watch it immediately. Why? Because they have created an impression in us that they want us to, they keep engaging us. So your supporting paragraph should be engaging along the line till you get the employer to sit down and read your supporting paragraph to the end. But if I start reading supporting paragraph at the first paragraph, the second paragraph is watery, trust me, I'll just scan through the remaining one to fulfill all righteousness. I won't definitely go into detail about your supporting paragraph. Then at this point, I think we've been able to do justice to the question, to the objective of our goals of discussion, except for one, which is preparing for an interview, which I definitely understand that Princewill have done justice to it, and I'm sure.
Yeah, sorry, Mr. Abiola. Yeah, Princewill did a little bit of justice to it on Wednesday, but I want you to exhaust, maximize the time as well. If you have any key details about that, any additional information will actually go a long way. So if you want to comment on that too as well, I would sincerely appreciate that.
Okay, thank you. Now, preparing for an interview, picture yourself like your interview. Picture yourself in a way that your life depends on an interview. You pass the interview, you leave. You fail the interview, you die. That is the way it is. I'm not saying you should die. Please don't quote me wrong. What I'm saying is that you should maximize every opportunity that is given to you in an interview. Now, bear in mind, you must not pass every interview. No. But for every interview, you should learn a lesson. Even after you've gotten a job, probably further engagement in the course of climbing the ladder in your career, you always have interviews and interviews. Every interview should leave a distinct part in you before leaving. Now, when preparing for an interview, the first thing you should do, I got a job offer, I got an interview date with Queen Alexandra Hospital. After getting the interview date, the first thing I should do is to go and read about the trust values, mission, and goals. That is the first thing to do. Read about the trust values, the mission of the mission and goals. Now, the second thing you should do is to increase your what do you call it, your network. Look for people that are working in that hospital, people that have passed that with their previous interview. They are the best people that will give you the right information on or possibly the possible questions that you will be asked. That is number 2. The third thing is that be ready for the interview. Most of these interviews are being done on Skype. Most of these are on Zoom, some on Skype. Whatever the platform that is given to you, make sure you are utilizing it very well. For example, you are told that you are going to do a Skype interview. Before the interview date, get friends and colleagues and test your Skype before the interview date. Ensure that you have good network. Now, what I do is this. This is my advice. When you are preparing for an interview, it is
sorry to cut in. There are a lot of people saying they are in the waiting room. If you can just check and permit them in, please.
Okay. I think only one person is in the waiting room as at now.
All right. Thank you.
Because I'm actually doing it as I'm talking, as I'm.
I know it's a lot of responsibility. Just permit us.
Yes, no problem with that. I'm actually only one person, and as at now, nobody's in the waiting room.
All right. Thank you.
Now, I usually advise that if you don't have a laptop, when you have an interview date, if you don't have a laptop, please go and borrow one. I'm not saying you should borrow one. If you cannot see, your phone should be the last option for you. Yes, you can use a phone. No, I'm not saying you shouldn't, but the best option is to use a laptop. Why you don't want to use a phone is this. If your data is on, calls can come in. If your data is on, even when you switch off the calls, the normal calls, WhatsApp call can come in, any calls, Facebook call can come in. So it is best to look for a laptop and make sure you get a Wi-Fi, even if it is to beg somebody. Make sure you are using a Wi-Fi. This gives you an interrupted session with your employer. If, for example, you are doing an interview and a call came in, remember, calls can come in to disrupt you and probably you lose your balance. What about if a call came in and it is a distress call at that point? Okay? So we should think about those ones. That's why I always advise that using a laptop is the best, not ruling out totally the use of a phone, but if you are using a phone, make sure that you make necessary arrangements to be sure that you're not being disturbed or you're not being interrupted in the course of the interview. It is not nice when an employer asks you, can I meet you? And you are like, hello. They can decide to, okay, let's reschedule. It's like you're having a network issue. Let's reschedule. My dear, if they are rescheduling everybody, you won't. It's definitely, that time that was given to you, a lot of people are also in the timeline, in the line, waiting for their own interview. And if possibly you have done that interview at that point, you might have created an impression they will like, and they feel like we release the person for the job. If you miss that opportunity, the next person might be the one to create the impression, and that is how you miss it. Even when they reschedule the interview with you, it will just be to fulfill all righteousness. Now, that's number 2. That's another one. I don't know whether it's number 2 or 3. Then another thing we should look at is that if you are applying for the surgical department or the surgical unit, you should endeavor to know at least if it is a touch of what they do in that department. That is why I say increase your network. Try as much as possible to know, okay, like if you're applying to my department now, the emergency department, I will tell you not to read anything about trauma nursing because most likely you will not get trauma nursing as a question. What you will get most are medical emergencies, something of cardiac arrest line. So I will tell you, okay, engage Abiodun is an authority in medical emergencies. Try as much as possible to fix a date within and it will help you out. So that, but if you are talking about trauma nursing, I will say, okay, if you are applying to a trauma center, like we have a trauma hospital in Southampton, it's also an emergency department. We have a PHU, that is Portsmouth Hospital Trust. It's also an emergency, as well as its emergency department, but two of them are different. Southampton is a trauma emergency center, while Portsmouth is a medical emergency center. So if you are applying to either of these two, you need to be sure of which one you are they offer. Any trust you are going to, you need to be sure of what they are offering. That is why increasing your network and getting an insider is very, very important. Now, there is something we always miss in all these things. You have the best CV, best supporting paragraph, best everything. You have done well. Your comportment on the interview date is very, very important. Because you are doing an interview and it is Skype, some of us, thank God, or it is Zoom. We have seen incidents, even if it is jokes and stuff like that. We have seen incidents where somebody is on WhatsApp, is on a Zoom discussion, probably an office discussion. You see them wear a good tie, nice shirt, but when they stand up, what they see is under is a boxer. Try as much as possible to represent a situation where you are in a physical interview. The way you will dress to a physical interview should be the way you dress to a Zoom interview. The reason is this: unconsciously, you might actually get to stand up or do anything that will give you away if you are not dressing right. So it is important that we dress the way you would have dressed to a physical interview. Now, above all preparation, God is the ultimate. God is the ultimate. Whatever your level of preparation, whatever your everything, put God first and put him last in everything. And I'm sure we all are going to scale through and get our dream jobs. That you are getting that unfortunate message does not mean you are not, or does not mean you are worse. No, you might not have the right information. I'm sure this night on Wednesday and the next, the other classes, by the time you go through all these sessions together, it will have added one or two things to you that will help you in getting that job you have been waiting for. I wish all of us the best of luck. And it is at this junction, I will only introduce myself briefly. My name is Olaniyan Abiola. I'm a Nigerian trade emergency nurse, and I look forward to meeting all of you. I look forward to welcoming you to the UK. I look forward to meeting you at the ITRO, and let us take the world together by storm. Thank you so much. Abiodun.
Thank you so much, North Africa. I sincerely appreciate this session. Thank you so much. By the way, guys, I'm sure Miss North Africa is very modest, and just to emphasize again, he was awarded the best emergency nurse in 2017 by the Nigerian Nursing and Midwifery Council. You know, it's not easy for you to be a nurse, and then they should now award you to be the best emergency nurse in Nigeria. That's not a simple or a mere beans award. You know, it's actually a big one. Thank you so much, North Africa. I sincerely appreciate your time and commitment. And I know a lot of people have benefited from this. I can see in the chat box that a lot of people are thanking you. Can you give me back the host so that I'll be able to, if that's fine?
Okay.
Yeah, and then we'll move quickly to the question and answer session. For the question and answer, I would just want everyone that have a question to just raise their hand up. Then I unmute them and they can ask the question and you answer. I have, please, let's mute ourselves for now. Yeah, let's mute ourselves for now. If you have any question, just raise up your hand, then I'll unmute you. Okay. Before they ask their question, I have my own personal question because I've been writing some notes. Yeah. And I'm asking them on behalf of some people. Number one, you mentioned that laptop aspect. I'm starting from the back. For those that'll be doing their interview, you said they should get a laptop or they should borrow one. Can you please emphasize that aspect? Because Prince Will on Wednesday mentioned that somebody actually failed the interview because the person do not have a good internet connection. can you please emphasize the importance of having a good network and also the laptop? Because I noticed that a lot of people, I won't say they are stingy to themselves, but they don't have all of these resources, to buy all this equipment. Can you just emphasize the importance of having those things in place?
Okay. Okay. What I said, you should, as much as possible, use a laptop for your interview. I think I made a scenario of how some of the reasons why you should have good laptop and a good network for your interview. One, laptops tend to give you a form of confidence. That is the first thing you should note. It tends to give you a form of confidence that transcends from you to the employer. Like, when you are confident going for an interview, you know what it means. You get your words right. Even when you don't answer questions right with confidence, somebody might think, you should remember the way we do in nursing school, when we are not an authority yet, and you'll be saying rubbish to examiner, but you are saying confidently, and the examiner will tell you, I like your confidence, but this is the right answer. That is one. Two, good internet connection. And what are the ways to get those good internet connection? Like I said, if it is possible, go and get a Wi-Fi. There are places where there are public Wi-Fi. If you don't have, look for it. Why, as you are preparing for IELTS, for job interview, as you are doing your job application, also be looking for things that will make the job application work. Offices, I'm sure if you come to my office and tell me, sir, please, I'm applying for a job. I want to do an interview and I need a Wi-Fi. No sane person, once you meet the right person at the right time, will deny you. Even if you don't have that, you can actually get all this smile. I'm sure there is smile, what do they call it? 8,000 and so. Get it at the back of your mind that if you get this job, it is an end to poverty. Are we together?
Now I enter.
It is an end to poverty.
I felt that. Holy Spirit.
If we have it at the back of our mind that once you get this job, it is an end to poverty, trust me, you are going to do everything to make it work. If you understand that they have told you that UK RN does not earn like US RN, UK RN does not pay. There is a lot of tax in the UK that prevents you from saving. If you now understand that despite the little pay, despite the, how do I put it, the tax and everything, people still come to the UK, make life out of it, and you cannot be outside and fight somebody that is inside. It's only when you get inside. There are informations I wouldn't be able to give you now. Why? Because you are outside. But when you get inside, I'll be able to tell you, okay, this is how you do a bank job. This is what is required to be an agency nurse. This is what is required to work here and work here. And by the time you put it together, you understand the reason why you need to end that poverty in your line. If you are like Ubon King said something.
May his gentle soul rest in peace.
May his gentle soul rest in peace. Ubon King said, anger is a gift of God to man if used rightly. It is only when you are angry with your present position that you aim for higher position. But if you are comfortable in your present position, trust me, you won't aim for higher position. Let the anger of whatever you have passed through to this stage motivate you to do anything legal, the word legal, anything right to get this job done. So having a laptop, if it means to borrow from a friend, I don't want to borrow from you, look at me. No, don't be shy. Borrow the laptop, get the interview done, pass the interview. When you get to the UK, you will buy a laptop and tell him thank you for borrowing you that laptop that time. Is that okay? Hello?
Yes, that's okay. Thank you very much. I like that. Another one quickly again.
Can I stop sharing my...
Yeah, you can stop it. Yeah, another one quickly is the supporting statement. A lot of people have actually sent me there, and I know you mentioned it in the presentation. In fact, you spent a slide and some few minutes to talk about supporting statement. But the common practice that I've seen is that people copy and paste supporting statement. How do people write supporting statement? In summary.
Okay, I think basically if we have followed this lecture from the beginning, most of the things I draw more on supporting paragraphs, writing a supporting paragraph. So writing a supporting paragraph needs our total attention. It is as good as if we see this application process as not, let me just apply, as I want this. You spend your time. So writing a supporting paragraph, like I said earlier, it should be a structured process. Now, the first part of the supporting paragraph should be able to tell the employer who I am. Then follow the PPF process. The PPF is the past, the present, and the future. Now, the past is, this is what I have done in the past, this is what I'm doing presently, and this is what I hope to do if given the job. So you transmit it in such a way that you are not telling the employer that I'm already working with you, but are telling the employer, creating an impression with the employer that I'm already employed. So that is a bad supporting paragraph. A lot of tips have been shared. I'm sure when you, by the time the record copy is out, people should be able to go back and actually look at how much we dwell on writing supporting paragraph. It is you in written words. That is supporting paragraph. It is my supporting paragraph is Abiola Olaniyan in written words. So when we're able to do that, it will be very helpful.
Thank you very much, Mr. Los Africa. I so much appreciate it. Yeah, a lot of people are asking in the platform, on the chat, that they missed the CV class. The record is available, and the record for this also will be available on the YouTube platform. So I'll be allowing people to now ask questions now. If you have your questions, can you please just raise your hand up? I can see some people are raising their hand up. I'll just allow them to unmute. Galaxy A32, can you unmute yourself and ask a question? Okay, Francisca, can you unmute yourself and ask a question?
Yeah, good evening.
Good evening.
Good evening.
Thank you, Mr. Abiola and NJC. Thank you for this lecture. I actually missed
It's not NJC, it's NJO.
Oh, sorry, NJO Healthcare. I missed the last one, so I said I won't miss this one. Yes, very quickly, I have two questions. The first one, when writing the CV, like if I've not written my CBT yet, is it advisable to have like a structured CV and then maybe edit later after passing the CBT? That is one. And then the other one, like I'm a midwife, and I already registered for adult CBT. Yeah, CBT. I don't know. You just said it now that midwives can actually apply for a Band 6 job, while averagely everybody is like on a Band 5. So I don't know. Is it that would I have to write another one for if perhaps I really want to have the midwifery job? Do I have to write another one, or is it just advisable to just go along with the Band 5, the adult nursing? Thank you.
Okay. Okay, quickly. Can I react to that quickly?
Yes, please, yes.
Okay, on the CBT or writing a supporting paragraph that you have either you have passed your CBT or you have not passed your CBT. I remember back home in Nigeria when I'm applying for a job, that the job that my job before coming to the UK, I have a senior colleague who is like a mentor, Jude Chedu of Nursing World Nigeria, that will tell me that when you're applying for a job, put those things you don't even have. Once you know, you can get them.
Okay.
So when I'm applying for the job I did last, I was never an ATLS trained nurse, I put that I have ATLS. I put that I have PALS. Then I never had PALS. Are you getting me? So the dad was called that, okay, you have this. I said, yes, very sure. What I did quickly was I called Jude. I've gotten this, this is what they asked me. Those things can be done under 3 days. You can write your CBT under 2 days if you are well prepared.
Yeah.
So I would say you should put that you have actually passed your CBT, or be vague about your CBT. You can say every necessary process have been completed.
Okay.
Do you get the idea now? So
yes, I do.
Then number 2, about being a midwife and adult CBT. I'm not too sure about this information, and I'm sure Abiola can actually corroborate it. If you have done your verification, Nursing and Midwifery Council of Nigeria verification as an adult nurse, go with adult nursing.
Oh, okay.
If you have done your verification as a midwife, go with midwifery.
Okay.
I think that's the best response to that.
Yeah, you did justice to that. That's the best response.
Thank you.
Okay.
Good. Just a minute. Man, I'm trying to admit people and coordinate this thing is quite hard, to be honest. I see what you are doing now. It's really, okay, so Deborah, Deborah, can you unmute yourself and ask a question?
Hello, good evening.
Good evening, yeah, good evening.
Thank you very much for this impactful teaching. I really appreciate it so much. I graduated 2014, and since 2015 June, I've been working as a company nurse. I work in a company site clinic, and I've not had any hospital experience. I consider myself to be very intelligent, and I know that I'm a fast learner. We do normal outpatient treatments. We do not really retain patients. When we have very serious cases, we refer them to the hospital. Although I presented this issue on WhatsApp, and Mr. Gosuyo advised me to maybe resign from my job if I've been able to secure a job in the UK, to get an experience in the hospital. I should volunteer maybe for 3 weeks or so. So my question is, what can I do to be able to get a job? How should I present my CV? How should I present myself in such a way that they wouldn't look down on me? They wouldn't think that I don't know anything since I do not have any hospital experience. Should I lie that I've worked in a hospital before? Would it be fair to lie? That is my question, because it's really bothering me and I'm scared.
Okay. If I may ask, I don't know if you would want to share the name of the company. Why I ask is also because I know a lot about company nursing, about company jobs. That's right.
Okay. I work in Life Flour Mill.
Okay. Okay. So this is the idea. Basically, working as a company nurse exposes you to more emergency cases.
Yeah.
So what your CV should look like is a CV that is tailored towards, or probably a supporting paragraph should be a supporting paragraph tailored towards emergency care.
Okay.
Referral is part of nursing. You can actually put it as part of what you do. Acute management of acutely ill individual with several cases ranging from cardiac arrest to various other medical cases. Yes. Trauma cases like falls. Remember, in the UK, they have a lot of falls.
Yes.
Are you getting me? So
yes,
you look at the loopholes in their own system. Like in the UK, they have more of falls. They have more of MI, cardiac arrest. These are things you put in your supporting paragraph and actually make up your CV. You shouldn't put something like you're working like accidental emergencies. Like we have a case where we're talking about maybe machine.
Yes.
So that should not be the line of your thoughts. You can add it, but should not be the line of your thoughts. What should be the line of your thoughts is about how you care for acutely ill.
Yes.
People.
That's what I majorly do, yes.
So that should be your line of thought. It's now your ability to expand it on that line of thought that gives you a good CV and a good supporting paragraph. Now, Gottfried has said you should get a voluntary job in the hospital settings, gave you a very good advice. I know company job, we still have off days. At this point, what should be your target is how to get out of that country. So even out of your 5 days or 7, maybe you are on 2 weeks on, 2 weeks off. Out of your 2 weeks off, use 4 days to go to the hospital, do a voluntary job, get an hospital that is busy. Go there, do an emergency, do a voluntary job. Put it in your CV that you have done more voluntary job in so places. Be sure the hospital you are using can actually reference you if asked. So voluntary job helps to boost your CV. It helps to boost your supporting paragraph that you have done support voluntary job. It shows to an employer that you are a selfless nurse. Are we together? So in case you are hearing me, that is about that. I'm sure, I hope I've been able to answer that question.
Yes, you have done justice to that. Thank you so much. Just to add to what North Africa said, Deborah, if you can hear me clearly, most emergency nurses usually jet towards working in the company. And when you work in the company, you should not feel less as a nurse. Once you are a registered nurse, you are a registered nurse. So, you know, don't be afraid. You said you are afraid. I'll tell you not to be afraid because you are a practicing nurse and you have been working as a nurse, but just that you have been working in the company setting. So just emphasize that emergency care aspect of your nursing practice during your application. So yeah, that we'll move on to the next question.
Please, before we go to the next question,
okay,
please,
okay.
I saw a message now. Somebody said, hello, I joined late. I heard something about lab coats. Are we supposed to wear lab coat for interviews? Nobody said that, please.
Okay, yeah. Lab coats, no, not lab coats for interview. All right, so Suala, can you unmute yourself? I don't know if I pronounced that well. Soale.
Okay. Suala.
Suala,
Good
please.
evening, this program. Good evening, North Africa.
Good evening.
Thank you very much for the nice discourse. Okay, North Africa, you mentioned that you share your own supportive statements. Please, can you help us with it so we have a mental picture of what you thank you.
Okay, I should possibly forward my own supporting statement to the group, Abi.
Yeah, I think that's what the person is asking for, so that they can have a picture of what a supporting statement should look like.
Oh. Well, is that the right thing to do, Abiodun? I don't think so.
I don't know. I mean, after all you have said about supporting statements, a lot of people still might not be able to get it. I will discuss privately and see how we can come up with a structured supporting statement. And
yeah, I think that would be better.
Yeah, so that people can, you know, have an idea of what it looks like.
Yes.
All right. So, Jasmine, Igo, can you unmute yourself and ask a question?
Good evening, guys.
Good
evening, Nurse Abiodun, and good evening, Nurse Africa. Thank you very much for this forum that you guys set up. It's been really, really educative and informative. So my question is about the CV. You did mention that it is not right that we use one CV or same CV for different job applications, that it's important that we try to alter them to suit different job roles or different vacancies. So what I want to ask is, if you are applying for a particular kind of job, for instance, I am always applying for the role of a theater nurse or a scrub nurse, and most of the job description or person specification for these jobs are very similar. How do I now alter my CV to suit these jobs, knowing fully well that their job descriptions and person specifications is very, very similar? Do I still need to alter it, or can I still use the same CV to apply for all of these vacancies? That's just it. Thank you.
Okay, thank you so much for this question. And to be very straight in answering the question, every job description, every job offer have a job description. No matter how close they are, there are differences in those job description. What I will always advise is that the job description, that job specification that was sent by, that is attached to each job, should form part of your CV. So if that is what is forming part of your CV, it means your CV will definitely be flexible. That will not take out the organic content of your CV as being a peri-op or a theater or scrub nurse. That will not take away the organic content of your CV, but it will only you should be able to play with words when it comes to arranging your duties, the job you do presently. But the main content of being flexible with CV is I will use the same CV or almost the same CV. Let me use that word, almost the same CV, if I'm applying to the emergency department, having known that the emergency department I'm applying to are just a replica of itself. But I wouldn't use the same CV I'm using to apply to the emergency department to apply for the acute medical unit. There are two different departments. There, yes, it is still the same me, the same qualification and everything, but I will use different words entirely. But if I am applying, like you said, applying to a scrub nursing role in the UK, you should maintain the same organic content of your CV, but be flexible with words. That is just the way I will put it. I hope you understand that.
You did justice to that. Thank you. All right, so the next question is Adepoju Inyoluwa. Can you unmute yourself? You can ask your question now. Inyoluwa Adepoju.
Can you hear me?
Yes, we can hear you.
Okay. Good evening, everybody, and thanks for organizing this. It's been helpful. So I have two questions. A while back, you were talking about reference and all, and then you stated that your current employer should be your reference. Because is it possible to use both your current and your past employer at the same time, like to give two reference?
Okay, that's the first question. Any other one?
Okay, the other one was that you stated about, you made an example about emergency nurses, and you were like, if you're an emergency nurse, you can apply for, anyways, my question is, for example, I had a remote job as a clinical trial assistant immediately after my graduation last year. But I quit the job last month, and immediately I'm actually working at as an audiology nurse in a private hospital here in Nigeria. So I want to ask, is it possible for me to apply for other jobs like that? It's not related to where I'm working now. For example, I'm interested in working as an OR nurse. So is it possible to apply for jobs outside your experience?
Oh,
thank you.
Okay, thank you. About the referee, about using your current employer as referee, what I said is it is good to use your current employer and possibly somebody from your academic engagement as referees. While it is not bad to use your former employer as a referee as well. But on the scale of priority, the first priority should be use one person from your academic engagement, use one person from your current job engagement. The second priority will be somebody from your current job engagement and somebody from your previous job engagement. They are another priority. One is preferred to the other, but the two are good. What you should not do is to use a politician, especially when you're applying to the UK. You can use a politician when applying to the ministry in Nigeria, but when you're applying to the UK, stay away from politicians, stay away from religious leaders. it's very, very important you stay away from this group. Not that they are bad, no, they are not. But on the scale of preference, the first two we mentioned should be our priority. Then about your job, if you can apply outside your job experience, definitely you can apply outside your job experience. Just that if you are as an methodology experience is applying to a job in the theater, and somebody with a theater experience is applying to a job in the theater, you as an employer, who will you pick?
Definitely the person that has the theater experience.
So that is how it works. That does not rule out the element of luck and God. But humanly and liberally, the person you would pick is somebody that already have an experience in the theater that will just come in and probably lead little or minute training and guidance, as compared to somebody you have to train all over again to get the job done. So that is just it. But I'm not saying totally, I'm not ruling out the fact that you can get a job outside. There are people who never had emergency experience and work in the emergency department. So it is not a total rule out, but on the surface, you have somebody in the emergency, you have somebody with theater experience than somebody with audiological experience.
Well, thank you. Kehinde, can you ask your question now?
Okay, good evening, everyone. Thank you for the lecture. So my question is, for some applications, I saw that applications that they said they welcome applications from overseas nurse. So they do ask.
Hello, Kehinde, can you hear us? Okay, seems we lost Kehinde there.
Okay, before you call the next person, I saw a question. What kind of job should general nurses apply to? General nurses can apply to any job.
Kehinde, are you back?
Hello, can you hear me?
Yeah, we can hear you. We lost you in a minute.
Oh, okay, I'm sorry. I was asking that I opened some applications recently, those that welcome applications from tier 2 nurses. So I saw that some of them will ask if you possess the NMC registration, which they've told us to answer yes. And then they would later ask us for expiry dates and NMC revalidation dates. So what do we answer concerning that? Because I know that validation dates will be most likely after you've written OSCE. So how do we answer that?
Okay, you don't pick yes in the question.
Okay.
The question will tell you that what is the status of your NMC registration. You will see an option that say required and applied for.
Yes, I just see that. Then there's this further question aspect that we now type validation dates. I keep
no, it's only when
why.
you pick yes. When register, that is when you get the further question. But when you say required and applied for, you don't get further questions. You should just check when you're applying. When you're applying very well, you will see an option that gives you required and applied for, does not carry further questions. But when you say required, they will not ask you to continue your revalidation date and stuff like that.
Okay, thank you.
You're welcome.
Adobe, you can ask your question now.
Okay. Hello, good evening.
Good evening.
Yes, please. Thank you so much, NGO, and thank you, North Africa. I'm a registered midwife with good years of experience, but I see that on the platform, there is no advert for midwifery jobs. It's just nursing. While I appreciate that, I would also appreciate the fact if midwifery jobs in UK can also be included among the adverts that will be placed in the group. Yes, I'm on Indeed, I'm on Track and all, and I get other offers there. But then, since the admins are in UK, they could refer, because we have registered midwives in the group that would also be interested. Thank you so much.
All right, thank you so much, Adobe. We'll take note of that. And if there's any vacancy for midwives would share it as well.
Thank you.
Yeah, Ezeni Nnoka, can you unmute yourself and ask your question?
Hey, good evening, everyone. Good evening, North Africa. Thank you for this platform. My question is about the referees. I've been working in my present place of employment for the past 9 years. This will be my 10th year since 2012. So I want to ask, since this is basically, okay, the former employer, I worked there for like 6 months, and this is my only place of employment, and it's been long I left school. So I want to ask if it's possible to use 2 referees from this current employer and not reflect anything from my past employer.
Yes, it is possible. We are looking about good, better, best. That's what we are looking at. The best is 1 person from your current employer and 1 person from your academic engagement. The second, the good, the better is 1 person from your present job engagement, 1 person from your former job engagement. While the good is 1 person from 2 people from your current engagement. That is good, better, best. It does not, none of them is bad, but on the scale of priority, 1 is better than the other.
Okay.
Thank you very much. Do you understand
that
analogy? Because I understand it perfectly, but do you understand?
Yes. I think what I'm going to do now is to contact my guest lecturer, maybe nursing, the person that took us for pharmacology. Maybe I should add the person to the reference instead of using 2 people from my current employment.
Fantastic. That's a nice idea. And let me use this platform to reach out to nurses about losing our lecturers back in school. It is important that many of us, when we graduate from school, because we feel that we have been maltreated, we feel that they've done bad to us, you just get out from the school, collect your certificate, and you think that is all. No matter the bad they have done to you, console yourself with the fact that you are now a better human being, you are now a better citizen of the country. At least you now have something to do, as against somebody on the road doesn't have anything to do. There might be bad ones. Remember, there will always be a good lecturer in every school. No, if all your lecturers are bad, it means you are the one that is bad. So the good ones, maintain a contact with them. Every lecturer want to invest in their students. They want to be part of your success stories. So imagine a student coming to me like, sir, I want to use that as a reference. Man, I'll be happy to do that. I'll be able to refer you as far as I can beat my chest to say you are a good student when you are in school. So that is justice.
All right, thank you. So Stella, you can ask your question now.
Okay, good evening. Thank you, North Africa. It's your time. Thank you, North NGO. Please, I want to actually ask a question concerning the post to apply. Like, I'm a trained HD nurse. So, but I heard that if you want to apply for maybe for local, if you come over there, that it will be limited. Like, you will have much opportunity to be attending local. There's some units, some posts that you need to pick so that you can have much opportunities, like medical, surgical, or medical wards. So I'm a bit confused. Like, should I just choose posts that's like medical jobs, medical wards instead of high dependency units? I just need the one that I can have more chance of getting locum outside my main workplace. Thank you.
Okay, that is actually wrong information you have been given. The way it works in the UK is that when you come into the UK as a staff nurse, your duty rota is not what you see on the paper or anything. You download an application called Allocate Me, which is specific to your hospital. Now, when you download this application, irrespective of the ward you are working, the moment you register with the bank partners, I'm saying this on like what happens in the Portsmouth hospital where I work. Some hospitals are like my hospital is a bank partner. They use bank partners. There are hospitals that use NHSP. So irrespective of what they use in your trust, you get and you have registered with the bank partners or with NHSP, you get job opportunity, that is bank opportunities in every ward. You'll be the one to choose not to work again. Trust me. NHS is on complete shortage of staff. Let me give you, yesterday, I got a mail. I don't know whether it happens in every hospital. Biodo can actually attest to whether it happens in the hospital.
Yeah,
I got a mail in my from our bank partners that next week, between 21st and 24th, that's between Monday, 25th and 29th, which is Monday to Thursday, if you can do 3 extra shifts, they will pay you extra £200. If 3 of your extra shifts next week can include on Friday, they will pay you extra £250. That is how short they are. Trying to entice people with £200, £250. So irrespective of what you are working, you'll be able to book bank, even book agency job outside your hospital when the time is appropriate. So that's the wrong information you have gotten. Irrespective of the one you are working, you can book bank jobs anywhere, even outside your hospital.
All right. So, Tolia, can you ask your question? Tolia, are you there?
Yeah.
Oh, okay. So, Chika, can you ask your question now? Chika, can you ask your question? Okay. It seems like we lost Chika and Tolia. I'm just trying to check the chat if there's any question from there. And okay, so Ruth, can you ask your question?
Thank you so much for bringing up this topic and the speech so far. I really appreciate it. Please, I have a question, and my question is, presently I work at a teaching hospital, and I've only worked, I'm only working for there, or I've only worked there for 2 years, and luckily for me, I got an offer, but they stated that I must have part of what I'm going to submit should be references that covers 3 years experience. And I remember in my CV, I stated it clearly that where I'm working now, I've only worked for only 2 years, but I've worked in other hospitals like before getting this job. So my question now is, if I want to use references now, what am I going to do? Is it that I will now look for somebody that will have to, stand as referee for me in this my present hospital, or the reference from my previous? Really, really confused. I don't even know what to do.
Okay, let me get, I got a question, right? And like I said, your referee should be from your school, the preference from your school and your hospital and your present job engagement. Your referee.
Okay, sorry, let me cut you there. They said work history, as in 3 years work history, they specified.
The work history. Now, if they specify that you should have a reference that covers 3 years work history, it means you use one person from your current workplace and one person from your previous workplace. But if it is not specified, it should be that your reference in school should be able to cover you from your time from school till this moment. Okay. That is definitely more than 3 years.
Okay, so how about how many years without my previous employer, right? You get and how many years? This one now can cover for 2 years, good and fine. Is it that my previous employer now will now specify that I worked with them for only 1 year or only 2 years? How many years?
For the period you worked with them.
Okay, they should just state it clearly there.
For the period you work with them.
Oh, okay.
And that is one advantage, that having a reference from your school as over having from your previous engagement. If it is from your school can actually cover you till present.
Okay.
Is that answered?
Yes, thank you so much.
Okay. Okay, Abiodun, Chika is asking for you to unmute us, whether she can't unmute or mute herself. Hello, can we hear me?
Yes, we can hear you.
Yes, we can.
Okay.
I can hear you though.
Okay, if you can hear me, I don't know. Abiodun is not, it's not coming up. I'm trying to like reach him.
Oh, okay. Can you hear me? Can you hear me? Yeah.
Okay.
I thought I was on mute already. Yeah, Chika, can you talk, Chika? Chika, can you unmute yourself?
She said, I think Chika said, if you read the message, the chat room, she said she can't unmute her. So maybe you can. Can you?
So can Tonia unmute herself then? Tonia, can you ask your question now? Okay, I think Tonia is not with us. Yeah. So thank you very much, North Africa. We've done a lot of questions and answers. Please unmute me. Chika, I can't unmute you. You have to unmute yourself. And if you can't unmute yourself, you can just quickly type the question in the chat box and then we'll pick it up. Antonia, if you can just ask your question as well. Okay, so the answer of no question. South Africa, thank you so much. I sincerely appreciate this. I'm going to edit the video and we'll upload it on the YouTube channel so that those that are not part of this meeting today, they'll be able to catch up. And please, if you're hearing my voice, go and watch the replay if you're not part of the class on Wednesday. And if you're part of the class, watch it again. You know, there are some informations that were shared, probably you were distracted or something that you might not get. And this class as well, for those of you that are here from the beginning to the end, you might not really get the full details or the full info. Well, go and watch the replay. Once the replay is out, watch it again so that you'll be able to edit your supporting document and you start doing the right thing, you know, for you to get interviews. Because the most important thing of all of this meeting is for you to make a right application and then they reply you for an interview or they book you for an interview. You go for the interview, you pass, and then, you know, your journey to be a UKRN starts from there, basically. I think somebody's asking a question in the chat room.
Okay, the question is, please, sir, can the person who gave the medical fitness still be one of your referee? This is very dicey, but I advise not, the person shouldn't be, because I've seen a case where the person that's giving your reference should be your GP. That's how it is. That is how it looks like. The person giving your medical fitness should be your GP. That's your general practitioner. Although in Nigeria we don't have a distinct one, but I would advise that even if you work in an hospital, definitely you have more than one doctor. If you are using a doctor as your referee, use the other doctor as for medical fitness so that it doesn't collide together.
All right.
Okay, he said for someone who only worked for a year and went back to school, is it possible to include the school experience in your CV? Your work experience is your CV, not your school experience.
Dunia, can you ask your question now, Dunia? Unmute yourself and ask your question. Tonya, we can't hear you. We can't hear you, sorry. Just type your question in the chat box and then somebody will pick it up. Okay, so I think there are questions in the chat box again. I have yet 19 years experience and all tutors that have taught me have retired. What should I do?
Then you go for the current and the past employer.
Yeah. But North Africa, can you quickly, I'm trying to balance it, right? So here in the UK, there are a lot of nurses that are short-staffed, a lot of NHS that are short-staffed. And they are back home in Nigeria, a lot of nurses that are past CBT and IELTS, midwives, nurses. And it's quite difficult for them to get job. And yeah, we are short-staffed. I mean, what exactly is happening? Because in the last 2 years, we won't be having this meeting. There won't be need for this meeting because literally every nurse that passed that year. I remember one time on LinkedIn, they are begging people to come to the UK as a nurse. They are begging, agencies are looking for you. Even if you don't write IELTS, some are saying they'll pay you to write the IELTS so that you can come over. But now the story has changed. What is happening?
Okay, I think what has happened is this. Well, number one, Nigerian factor affected the migration of nurses to the UK. Nigeria still collects grants from the UK till tomorrow, which make what the WHO to restrict UK from actively recruiting from Nigeria. So presently what they are doing is passive recruitment from Nigeria, where you have to apply for yourself and they have to prove to the Home Office that there is nobody that can do that job you are coming to do before they will grant you visa. Now, before this time, 2015, 16, 17, when migration to UK became a boom in Nigeria, I know then, the moment you have an intention, you are not even registered for IELTS, you don't have a passport, you just have an intention to write IELTS, you get in contact with an agent who tells you, okay, agency, you have an intention to write IELTS, they start coaching you for IELTS at that moment. So, and now it is moving, it moves from getting an intention to when agent will tell you, write your IELTS yourself and get a decision letter. Now they are telling you that, okay, don't write your IELTS and get your letter, write your CBT and even pay for everything. Now it has gotten to where you have to apply yourself to the NHS. Now it has gotten to a stage where after applying and getting a job with the NHS, they will tell you to sponsor yourself down here before they refund you. Now I nailed that to the Nigerian government and the Nigerian people. Now we've seen a situation where NHS got job, and that is what that's what we try to preach. If you have gotten a COS, if you have gotten an offer, before you be given COS for an offer, you will be told to check out, you are advised to check out the trust you are going to, the city you are going to. You don't make an employer go for COS. After they have done COS for you, you now decide that I don't like it. Maybe you have gotten another job somewhere else. That creates an impression in the mind of employer towards your country. And a lot of people have done that in the past. It is one of those things that's why I said Nigerians is affecting the people coming in now. We keep shouting shortage of staff every day, shortage of staff every day. I finally told my manager one day that I'm sure this shortage of staff will end if NHS, NMC UK decide to hire 10 BA, British Airways, park Station 5 in Abuja, Station 5 in Lagos, and just call people that if you are a nurse and you are passing BT and IELTS, come and enter. People will not go home to pack their load. As far as they have their certificate with them, some even have their soft copy certificate, they will send this original certificate to them later. They will enter the plane just like that. Some people even agree to lap each other to get to the UK. That why is NHS not, why is the NMC and the NHS not towing the line to actively bring people into the, and the answer she gave me that, truth be told, this is what everybody wanted, but international relation bilateral agreement comes into play. Kenya recently going to an agreement with the UK about recruitment of nurses from Kenya to the UK. We all know what happened. Recently, our Minister for Interior in Nigeria, Reverend Abiola also said Nigerian nurses will have to go through interviews or face a screening board before coming to the UK. These are things he said by mouth, but trust me, if they actually want to implement what is on the paper, they are going to do it. It's going to be like that. So, and that is why my advice to people now, to nurses in Nigeria now, is that, yes, some of you want to go to the US, but trust me, it is easier getting to the US from UK than getting to US from Nigeria. So get yourself into the UK first. When you are not satisfied with what you see in the UK, it is easier for you to make £1,000 in the UK, which is 770,000 naira today, in 2 months than making 770,000 naira in Nigeria in a year. So you have more funds to play around with when you come into the UK to go to anywhere you want to go to. So these are factors. The factors of we, the Nigerians, the nurses applying, and our previous our track record with previous applicants, and also the Nigerian state and the Nigerian system, or let me say the bilateral agreement between the two countries. These are the restrictions. These are factors that is causing the restriction we are seeing today.
Okay, thank you for that. So from the chat room, someone say, please, can I get the YouTube handle? I'm new here. See, this person should just go to, this person should send us a message. You can just go to our social media platform at NGO, send us a message, we'll send you the WhatsApp group link. For those of you that are here, probably somebody send you the Zoom link. Go online, go on social media, send us a message, and then we are going to add you to the WhatsApp group so that you can get the link for the replay of this session.
Okay, let me just answer 1 or 2 questions I'm seeing here.
That's okay.
Please, can I get the YouTube? Okay, we've answered that. Some of us are not on the okay, you have answered that. Please, sir, do not forget the sample supporting statement. We are going to work on that as promised. Please, must I send an official email address of my referee, or can a personal email address be accepted by the NHS? Official email is the preference, but if they don't have, personal email is also accepted, but the preference is the official email. That is by Chika. I have 19 years experience. I think I've answered that. Good evening. Can I use only one referee that covers a period of 2 years? 2 referee is what is required. 2 referee. That's why I would say use one from your present engagement, job engagement, and one from your school. Definitely you went to a school. You must get one from there. Can my lecturer who is not in Nigeria still be my referee? Definitely yes. That person, as far as the person can reference you, that's not a problem. Please, what is the conclusion of supporting paragraph? Do we send our supporting information for review? No, don't send your supporting information for review. We don't have the time, unless we will make promises that we will not be able to fulfill. What we'll do is that, as Abiodun have rightly said, we are going to put this together and bring out a concrete structure for supporting paragraph. And I believe from the structure, everybody should be able to build on it to get a good supporting paragraph. So thank you for the sacrifice. God bless you. I have an interview with Portmouth on Monday. I'm an A&E nurse and one first interview, but I'm a bit scared. Olufumi, please reach out to me as fast as you can. Trust me, you're already in the Portsmouth by God's grace. I'm ready to welcome you in UK. I don't want to give out my number on the main group on the platform support. I don't know how you can reach me. Okay, let me send you a direct message with my number so you can reach me on it. So just send me a WhatsApp chat. I just sent my number to you directly. Send me a WhatsApp chat and I'm going to guide you through Portsmouth. You are welcome to the city of Portsmouth. Then okay. Please, what can a university lecturer who have worked in the hospital before do to work in the UK nurse? Presently, in the accommodation I live with a lecturer from the University of Osun State. So working as a lecturer does not matter. You can always get a job. Stand a better advantage of getting a job also. Then, thank you for the class. I have biochemistry before my RN certificate. Is it good for me to include it in my CV? Does it have any advantage? No, it doesn't have any advantage. I also have physics electronics before going into nursing at all. Just keep the biochemistry aside. What they needed is your nursing knowledge and your nursing certification. That is it. Then definitely I will call my wife when I get there, my family when I get there, okay? Please, I can't hear you. Okay, true. How long will it take for one spouse to join him or her? Your spouse can join you from the day you are leaving Nigeria. It has to do with fund. If you have the fund to cater for it, your spouse can actually come to the UK with you. If you don't have the fund, that is why we advise that you face your OSCE, you pass your OSCE, then after passing your OSCE, you then can definitely save up and bring in your spouse. But from day one, if you have the fund, you can actually bring in your spouse. I'm just scared that one day our government will close the door completely on us. Well, we don't hope for that. We don't pray for that. We'll pray that as much as possible, people get in here and live better life. The more, the merrier. What can a university lecturer? Okay, I've answered that. My job with Northampton was withdrawn because I didn't have IELTS then. Can I write them to retrieve my offer now that I have IELTS? Well, you can do that. No harm in trying, and I wish you the best of luck. The mode of presentation of your letter matters a lot as well. So I wish you the best of luck. Thanks so much. Thank you for your help, sir. Please, I'm having an issue with arranging my experience. I've worked in 3 different wards in previous hospitals. How can I write my CV? That in my CV. Reach out to Prince Will Agedo. I'm sure he's going to guide you. I'm going to give you a fantastic CV on that. That is from Daramola. Please, I need someone working in Leicestershire Partnership Trust. I have interview with them on the 27th of this month. Then reach out to Abiodun. I'm sure it's good. He has a great network to connect you with anybody working in that trust. RAEN, that is emergency nurse. I have been applying for RAE jobs, but none is forthcoming. I've decided to apply for that position, but not really happy about it. Please advise me as an ER nurse. Wow. As an ER nurse, maybe you are not doing something right with your CV, your supporting paragraph and all those things. But I'm sure with this lecture and the previous lecture, and probably the one that will be held next week as well, you should be able to get your dream job. If you are on the group, you can actually find a way to reach out to Abiodun. Abiodun is also an emergency nurse. I'm giving me a lot of jobs. So it's also an emergency nurse. I'm sure it won't be hard for him to fix you up. God help you and God help him too.
Yeah.
Thank
you so much. Thank you so much. It's a lot of work, to be honest with you. It's a lot of work.
So
we have actually exhausted a lot of time here.
Yes, I think that's the end of the message.
Yeah, that's the end, really. That should be the end. Thank you so much, man. I sincerely appreciate it. It's been a long night, and I know a lot of questions has been answered, a lot of information has been shared. Please, for those of you that join in late, do ensure to watch the replay. And even if you don't join in, you start from the beginning, watch the replay again so that you can actually soak the information in and implement it. Outside of all of this that is said, the goal is to come here and work also. And one word that struck out for me, like he said, is that once you come here, you are saying goodbye or bye-bye to poverty. You know, I won't forget that in a long time. Thank you so much, North Africa. It's been an impactful night.
Thank you so much, Abiodun. I have to commend you as well.
No, man, I should commend you more. I'm really, really impressed. It's been, you hold the class so long, and we had a lot of audience. I was in 93, 93. This 93, people to join is really huge for me because I've been doing Zoom meeting, and this is like the highest I've recorded so far in my Zoom meeting. Thank you so much. I appreciate it. God bless you. God bless you. But by God's grace, we will not commit any atrocity, but we'll continue to share good news and testimony.
Amen. Amen.
Thank you so much.
You're welcome.
And we're going to put an end to this meeting today around this time now. I wish you all the very best, and we'll see you next week, Tuesday, 2 p.m. next week, Tuesday. Set your reminder, please. We'll be having Kelvin Osai talking about life in the UK generally and ways to progress forward. So good night, guys. Thank you so much, and bye.
Bye.